Hi, I'm Dr. Jonathan Pinto from Noble Choice Chiropractic, and today we're talking about how chiropractic helps to eliminate mid-back pain. You see, so many people nowadays are sitting for work, we're stuck in front of computers, and what ends up happening is we're leaning forward, our shoulders are rounding forward, our head is jutting forward, and we're working in that position for hours on end. When we're supposed to be upright with our shoulders back and down, and the head should be right over the top of those shoulders. Now, what happens when we see normal in through our spine, we have this nice curve in through our mid-back, the neck curves back up over there. The position we get into when we're sitting looks more like this, where we have this bending and going forward up into the neck. It puts a tremendous amount of stress on the joints in through this mid-back. And at first, what we see is you can have inflammation build up in those joints. But over time, that inflammation can lead to something called degeneration. And so when we look at the mid-back through a chiropractic lens, we're looking at how each one of those individual joints is moving. We need to see proper movement, something that's called internal axis of rotation. The only thing that can restore the normal internal axis of rotation is a chiropractic adjustment. And so when we look at a joint zoomed in here individually, we have your disc space in through the middle here. The nerves are all exiting out from the spine. These are what are controlling everything from the muscles that you feel tight to how all your organs are functioning. And so these nerves aren't communicating clearly with either the muscles or the organs. We're going to get an abnormal message and a response that you notice as symptoms. So if this nerve isn't communicating with the muscles properly, those muscles can fire abnormally and feel tight, where you're constantly trying to stretch, but until that message from your brain through these nerves tells the muscles to relax, we keep having that tension built up over time. So when we look at the spine, we're going to look for something that's called a subluxation. That's any joint that's not moving properly, and then there's pressure on those nerves. When you come into our office, if we find those subluxations, then we know we can help, because that's what we can fix. We're going to restore that normal movement, restore the normal internal axis of rotation, allow the brain to communicate through those nerves perfectly so everything functions as it should. If you have any questions, we'd love to help.